Please be seated. Good afternoon. I'm Patrick Delafontaine, Dean of the School of Medicine, and I'm really delighted to be here today to welcome you all to our graduation ceremony. I do want to start by apologizing for the small delay. I know that there was a person with a medical issue, and I'm delighted to know that it's been resolved and the patient's doing well. And I'm also happy that we did manage to find a physician here today. So this is a celebratory event, and we want you to enjoy it. It's about somebody you love who's about to become a physician. The faculty and I are here to help you celebrate this tremendous achievement. We're going to start the program today by hearing from Stephanie Peace, who was chosen by her classmates to offer a student welcome. Peer selection to me has always been a very special kind of honor. Please help me welcome Stephanie to the podium.
Thank you, Dean Delafontaine. Welcome, welcome, welcome to our esteemed deans, faculty and staff, friends and family, and finally, to the University of Missouri School of Medicine, class of 2017. We could not be more thrilled that you all have chosen to spend this beautiful Saturday morning cooped up in this auditorium with us. But I suppose that it's not every day that this many people are wearing robes outside of the wizarding world of Harry Potter. I want to extend a special welcome to friends and family who have traveled long distances to celebrate with us in person today. Along with folks from all over the state of Missouri, including the distant locales of Creve Coeur and Frontenac, David Rosenfeld, we've also got people here from at least 16 different states, from California and Washington to Georgia and North Carolina. We've even got family members who traveled from England, India, and Nigeria. To all of you and to everyone who is with us in spirit, thank you. I want to start off in a spirit of gratitude because there are many people here who deserve recognition. I can promise that this will be the only part of the speech resembling the Oscars, and though I can't guarantee that there won't be a La La Land type screw up later on, I'm pretty sure that at this point we're all going to walk out of here as doctors. First, thank you to the deans and faculty of the School of Medicine. You have served as our teachers, our leaders, and our mentors over the past 4 years. We are grateful that you have chosen to spend your careers educating the future generation of physicians, and we continue to be inspired by your dedication to patient-centeredness, evidence-based medicine, lifelong learning, and integrity. Thank you. Our educational experience has also been shaped by many teachers who are not here on this stage as faculty. To all the nurses, physician assistants, social workers, techs, and especially patients who have given us the opportunity to fumble around as part of the healthcare team, we extend our deepest gratitude. This day would not be possible without all of you. Just like at the Oscars, we also want to thank everyone who works behind the scenes, not on lighting and costumes, but on financial aid, residency paperwork, the Sim Center, support of our student-run free clinic, MedZoo, and all the coordination that it takes to herd 100 or more med students, through 4 years. Thank you to the entire staff of the Office of Medical Education for all that you do, and for doing it with a smile. We are also deeply grateful to our family and friends. You have not only supported us these 4 years with your presence, words of encouragement, and hot meals during exam weeks, but also played a pivotal role in shaping us into the people we are today. I don't want to go all the way back to the beginning, but Mom and Dad, thanks for talking me out of that phase when I wanted to be a concrete truck driver when I grew up. We would not be here without you, literally and figuratively, and so today is as much your celebration as it is ours. A big thank you is also due to all of the partners out there who have put up with years of constant studying, type A spreadsheet making, oh wait, is that just my husband? And finding out where we'll be moving via computer-generated algorithm. Thank you, and thanks in advance for putting up with us through residency. And finally, to the class of 2017, who walked in today as my classmates, but will walk out as my colleagues, thank you for your friendship, for challenging and inspiring me, and for giving me the opportunity to speak today. Why you gave the woman who spends half her time on a soapbox an actual podium is beyond me. But at this point, you're only stuck with me for a couple more minutes. Graduation marks both an end and a beginning, a time to look back on how far we've come, and a chance to look forward to all that lies ahead. When we sat in these same seats 4 years ago to receive our first white coats, we were a little younger, a little less gray, perhaps a little less cynical, a little more idealistic. We had not yet grown tired of hearing the buzzwords that make up Mizzou's 8 key characteristics for future physicians, phrases like patient-centered care and lifelong learning. But the last 4 years have changed us substantially. Some of us have gotten married, a few have had babies, others of us have just mastered showing up on time. Okay, I'm still working on that one. We've had a few broken bones, our own, not our patients'. We've undergone surgeries, we've lost loved ones. Through it all, we've remained committed to the dream of becoming physicians. Today, we finally earned those coveted 2 letters. But more than that, we earn a new level of responsibility. Not only will we be the one writing prescriptions and the one the nurse is calling in the middle of the night starting July 1st, we will also assume the responsibility of being an advocate for our patients. Having received an excellent education here at Mizzou, we are now among the most educated, the most privileged people in the world. The skills we have learned, using evidence as the basis of our decision-making, exhausting all possibilities to solve problems, communicating clearly and respectfully, working with teammates from all walks of life, and maintaining a high standard of ethical behavior. All these tools can be applied to medicine, but equally to advocacy. We know that health is more than the absence of disease, but is impacted by factors as diverse as a patient's last name and zip code, access to transportation, health literacy, and cultural and social support networks. In order to really make a difference in health equity and healthcare access, we must be prepared to use evidence to form effective policies, to collaborate broadly across disciplines, and to get creative to find solutions to seemingly intractable problems. Because we have been provided the tools needed to do this, advocacy is no longer a choice, but rather a responsibility. I am confident that among the soon-to-be physicians in this room, there will be people whose research will result in new disease cures, whose selflessness will provide care to patients who would otherwise be unable to access it, and whose determination to do what is right will result in policies that improve health equity and therefore health outcomes for people in America and throughout the world. I am proud to count you among my colleagues. When I first started writing this speech, I thought back over my previous graduation speeches for inspiration. At my college graduation, Amy Poehler gave one speech, but since my sense of humor is really only effective for eliciting groans, that wasn't really much help. And Ellen Johnson Sirleaf, the president of Liberia, gave the other speech, but, well, never mind, that one doesn't need any explanation. So instead, I turned to graduations in film, and thus I leave you with the wise words of Elle Woods from Legally Blonde. We did it!
Thank you very much, Stephanie. Today marks a very special accomplishment. You all have very much for which you can be proud, but it's important to remember that you did not make it to this point alone. I dare say there are some of you who would not even be here today if it weren't for the love, support, money, and cheerleading of others. Today's joys, tears, and feeling of fulfillment are to be shared. They do not belong exclusively to the graduates. Class of 2017, please rise and turn around to face family and friends. Take a moment to acknowledge those whose love, care, and all manner of support were instrumental in your being here today. Would the parents and/or spouses and partners of today's graduates please stand? Would the grandparents, brothers and sisters, aunts and uncles, any children of the graduates, or other relatives, please also stand so that you too may be thanked. There is another large group of people also deserving of the gratitude of our graduates, for without them, no degrees would be awarded today. They are seated behind me. Would the emeritus professors, the faculty, and the administration of the School of Medicine and the University of Missouri Healthcare please stand? I'd also like to introduce some very special guests who are seated on stage with us. First, the Honorable David Steelman, University of Missouri Board of Curators member. Dr. William Hines, alumnus class of 1984 and philanthropist. Jonathan Curtright, interim CEO of the University of Missouri Healthcare. Brian Steinis, Chief Financial Officer for the University of Missouri Healthcare and our School of Medicine. Steinis is not there. Dr. Kurt Nichols, Chief of Staff for the University of Missouri Healthcare. Dr. Ted Choma, Chair of University Physicians. David Isaacs, Director for the Harry S. Truman VA Hospital. Dr. Frank Romero, Chief Medical Officer at Cox Health in Springfield, Missouri. Dr. Mark Costley, alumnus class of 1981 and preceptor for our rural health program. Dr. James Feltz, alumnus class of 1978 and medical director for our rural health program in Rolla. And Dr. Eric Meidel, Rural Health Program Medical Director in Hannibal, Missouri. I would also like you to meet the leaders in the Dean's Office who are responsible for all of our excellent education programs and who will be assisting in today's ceremony. Firstly, Dr. Mike Hosokawa, Senior Associate Dean for Education and Professor of Family and Community Medicine. Dr. Lane Young Walker, Associate Dean for Student Programs. Dr. Kim Hoffman, Associate Dean for Curriculum and Assessment. Dr. Kevin Kane, Associate Dean for Education Improvement. Dr. Kathleen Quinn, Associate Dean for Rural Programs. And last but not least, Dr. Andy Evans, Associate Dean for our new Springfield Clinical Campus. Given an opportunity to select a member of the class to address them on this day, the class of 2017 has chosen Max Vale. Max, please come forward.
Thank you. Thank you, Dean Delafontaine, for the introduction. Thank you also to the associate deans, the faculty and staff, administrators on stage. And most importantly, as Stephanie said earlier, thank you to the families, the partners, spouses, friends, everyone who's here to celebrate with us today for this huge milestone. I'm so thrilled to be up here today to speak on behalf of the class. I'm also very excited because on stage today is my mom, who's hooding me as she celebrates her 40th year anniversary of graduating from this med school herself. As I was preparing for this day, I tried to think of what possible message or advice I could give my peers. I figured that you're all probably tired of me telling you to wear sunscreen. So I thought I'd better look to someone else for some wisdom. And then it hit me, something that a certain physician who has been practicing for 40 years has been telling me all my life. But I'm not going to reveal that deep and sage wisdom just yet. We'll get to it. In preparing for today, I also turned to my friends and classmates to ask other recommendations for this speech. And uniformly, I was told, be brief. I'm sure it had nothing to do with the length of my PBL objectives and presentations in first and second year, so thanks for bearing with me. But brevity is the soul of wit, so I will try to be brief. But if you'd like to leave now, I'm sure this is recorded and you can watch it at 2 times speed at home if you want later. We've trained in a self-directed curriculum, so I have 2 objectives for you. Neither of them require a PowerPoint, neither require a presentation, and you don't have to cite Harrison's and Robbins, so don't worry. The first objective sounds easy, but can be really difficult at times. And that's the advice my mom gave me, this daily recommendation to be nice to people. The second objective sounds very difficult, but I hope to convince you that it's rather easy, and that is to be meaningfully involved in our community, our medical community. So how do we accomplish this? How do we be nice, be involved? To whom do we be nice, and for what end do we get involved? We've already pledged ourselves already to our patients and their families, but we also need to tend to the relationships amongst ourselves. Look around you. The person to your right, the classmate, is the primary care doctor who's calling you for a consult. At some point in your career, you may think, wow, every single patient this doc sends me is not on the right management regimen, is not being treated well, is not effectively managed. They must know nothing about my specialty. But please take a second and think outside your compartment, to borrow a word a mentor of mine uses. Consider that every patient this doc sent you was one that needed your help, and that every other patient that he or she effectively managed didn't require your intervention. When you see only a tiny fraction of your colleagues' practice, you get a skewed view, and that slice doesn't demonstrate the wonderful success of all of the involvement of this provider. So remember that everyone is working to deliver the best care for their patients and to put their patients first. So be nice to your colleagues. Now look to your left. That classmate is the specialist that's sharing in the delivery of care for a complex patient with you. You may disagree at times, as we all have before, but you are each trying to do the best for your patient, to put the patient first also. In the same way, the insurance representative is doing the best to control costs so that everyone can get a quality access to care. Yes, they too are in the business of helping patients. So is the hospital administrator, the quality improvement specialist, and everyone else in our complex healthcare system. Each of these people chose a career that seeks to help people get better. And each group looks to themselves as helping, as contributing, and as making a difference. We must strive not to blame each other when our healthcare system fails us, when the industry is not working, but instead recognize how each of us can work together to fix the problems we have and create a better system for tomorrow. And this brings me to the second objective for today, to be meaningful involved in our community of healthcare providers. We've trained in a school that values feedback and affords us the opportunity to celebrate or criticize, applaud or complain about our curriculum, our faculty, and our learning environment. I know at times it's felt like we were given a Likert scale survey every time a new professor tried out a new dry erase marker. But for most of us, as we move forward, there will be fewer and fewer opportunities for people soliciting this kind of feedback from us. Not all programs, not all hospital systems, and not all healthcare industries are interested in our feedback as much as ours is. And yet, we're entering a healthcare system that needs our feedback more than ever before. The healthcare system desperately needs your input and your advice and your wisdom. So I ask each of you to keep speaking out, keep reflecting on your experiences, keep reflecting on the experiences of your patients, and keep complaining when things don't seem right. Society is going to give us a special place. In fact, it already has. And with that, privileges, a seat at most tables, and a voice that many will listen to. Join a committee, or 2, or 3, or 4, or 5. We have both this unique opportunity and sacred responsibility to be more than individuals practicing our art, but to be guardians of the health of our entire nation. To be as present and vocal outside of the exam room as we are within the safe confines of its walls. So I ask, be meaningfully involved in our healthcare community. At this moment, although we are headed into different fields in different cities and different states, we're still classmates, still PBL group members, still friends. We may live in our own compartments, but let's challenge ourselves to look beyond them. Our colleagues are our brothers and sisters. Let's be nice to them. Let's work with them to create a better healthcare system for everyone. We may never know what will come tomorrow, but we do know that today we have accomplished every single task put before us. We've earned this new identity that we're donning today. We're doctors. We will be doctors to our patients, our friends, to complete strangers, and to society as a whole. And we are equally responsible for the health of each of them. We will be looked to for leadership, guidance, empathy, compassion, and wisdom. The good news is, having spent the last 4 years working with each of you, I know that we have these qualities, and we're going to make a difference in this world of ours. So, let's celebrate this huge accomplishment today and respect the great privilege we're being afforded. So congratulations, class of 2017, and thanks for letting me speak to you.
Thank you, Max. It's my pleasure to introduce our commencement speaker today, Dr. Rachel Brown. Rachel Brown is Professor of Psychiatry, Associate Dean for Student Affairs, and Diversity and Inclusion Officer at the Central Michigan University College of Medicine in Mount Pleasant, Michigan. For nearly 11 years, she served the University of Missouri as Associate Dean for Student Programs. And in that role, she developed and refined our recruitment and reviewed our pipeline activities and developed new ones. With her support, our admissions committee introduced and refined a holistic review of our admissions process. Dr. Brown provided and organized advisory and support services for our enrolled medical students. And under her leadership, the school was awarded the Association of American Medical Colleges Award for a career advising program at their national meeting in November 2016. Dr. Brown has been personally recognized for her contributions by the Central Group on Student Affairs with their Exemplary Service Award and by previous graduating classes of medical students who chose her for the Robert R. McCallum Student Advocacy Award in 2008, 2014, and 2016. And as one of their investiture marshals in 2015. In her honor, the school has established the Dr. Rachel Brown Medical Student Scholarship Fund, Dr. Brown provided clinical care as a psychiatrist at the Thompson Center for Autism and Developmental Disorders throughout her time at the University of Missouri. Dr. Brown has published more than 30 peer-reviewed articles and book chapters and has presented many workshops, posters, and oral presentations at regional, national, and international meetings. She has held academic appointments at the Institute of Psychiatry and the Tavistock Institute, both components at the University of London. And at Mercer University, she also served as Associate Dean. Dr. Brown graduated from Guy's Hospital Medical School at the University of London and completed her residency in psychiatry and child psychiatry fellowship at Bethlehem Royal and Maudsley Hospital in London and at the University of Alabama, Birmingham. Please join me in welcoming Dr. Brown, who is our 2017 choice as commencement speaker.
Thank you, Dr. Hosokawa. And good afternoon. Well, actually, good morning. I apologize. Good morning to everybody. You look wonderful. And it's really a wonderful day. And I want to start off by saying congratulations to the graduating class of 2017. Thank you so much for inviting me to be your graduation speaker. As I said to John Clohesi, your class president, when he emailed and asked me if I would do this, it's a true honor. I've never done this before. And so for me, just as it is for you, this is a really special day. I'm thrilled to be sharing it with you, all of you, and with your families and friends this morning. This is the day when you walk across the stage from medical student over there to physician over there. You'll remember today as the day that you'll take on the burden and responsibility of being a physician. This is the day when your life as a doctor really starts. As has already been said, you are not here alone. You're here with your parents, your brothers and sisters, your grandparents, your spouses and significant others, your children, your families, your friends. They're the people who are celebrating with you today, just as they've been the people who've been alongside you throughout all the years that led up to today. I know that you're grateful to them for being with you through all of the celebrations on days like today, as well as through all the difficult times in your life that you've been through already and that are still to come for each of you. Our families teach us from very early on in our lives that we can't make it by ourselves. Much as we would like to believe from time to time that we're really independent and that we're powerful and that we're strong, we really aren't all of the time. There's a great song that they sing at English soccer matches that I've heard all of my life, particularly Liverpool, who I'm not so sure I'm all that keen on, but nonetheless, you really do never walk alone. And as physicians, we never walk alone. So that's the first thing I wanted to say. You aren't alone. There might have been a time when medicine was a solo, one-person activity. I actually think that I really doubt it. Even though there were solo practitioners, those guys, and they were mostly guys, those doctors, they had wives and housekeepers and children and people who worked with them and cared for them. The people that you live with, your family and friends, and those who will help you at home and at work are truly precious to you, just as you are to them. If you're fortunate in your working lives, you'll find yourselves working with people that you care about and people that you cherish, almost as much as the people that you care about and cherish that you live with and that part of your personal lives. You'll argue with them, I grew up in a family that argued actually quite a bit. So you'll argue with them, and you'll disagree with them, and you'll challenge them, and you'll support them. I have had the opportunity to be part of teams like that developed that sort of ability to trust and to disagree over the years that I've been in medicine, and I hope that you will have those opportunities as well. I think I was part of that over the last 11 years here at the University of Missouri School of Medicine, and I am very grateful. Like me, when your colleagues challenge you to do your best and support you in doing it, you will be grateful. You'll see their unfailing hard work and commitment to you and your professional development. They will set high standards for themselves, and in the process of setting high standards, they'll set those same standards for you. They'll do that because they will hold in mind the patients that you will go on to treat throughout your professional lives. Each of us, each of you, will see and treat thousands and thousands of patients. And by doing that and doing it well, you will go on to impact thousands and thousands of lives, of the families and friends of the patients that you'll treat. It's an awesome responsibility. And to do it well, we need to do it with the people who do it with us. We will need our families and our friends, and we also will need our professional colleagues. So like I say, my first thought, value your families, value your friends, value your colleagues. Never forget how much they've done for you. Always be grateful. My second thought is about learning. So I had a bit of an attitude when I was a medical student. When I was a medical student, I think probably like some of our, never mind. When I was a medical student, I thought I knew as much as I needed to know. I actually thought there was quite a lot that I'd had to learn as a medical student that I really didn't need to know because I wasn't going to be using it. I was going to be a psychiatrist, and I knew I was going to be a psychiatrist actually when I was 15 years old. And I went to medical school to be a psychiatrist, and so when they taught us all this stuff that was not relevant to psychiatry, I was pretty arrogant about it, and I ignored it, and I only learned as much as I really thought I needed to know to pass the test. And I have to say, and this is hard for me because I'm not very good at saying I was wrong, ask my husband about that, but actually I was wrong. There was tons and tons of stuff that I didn't know that I would have to learn. Plenty of stuff I was supposed to have learned in medical school that I'd ignored or learned just enough about, but very cursory. And I'll say that to you what I should have said to myself and what I learned the hard way as I've gone through medical school and residency and fellowship and into practice and 30 and 40 years later. Everything that you know now is just the beginning. Science will change. Medicine will change. The knowledge that you will need to take care of your patients will change. If you think you know it all now, you are wrong, just as I was wrong. Medicine will teach you some hard lessons. This really is just the beginning. That's my second point. Keep on learning. And then point 3 is about how hard it's going to be. Partly because there's so much to know, but not only because of the volume of information. Medicine is a challenging profession. You'll work with people at really tough times in their lives. You'll work with them when they're in pain, when they're disfigured, when they're scared, when they're uncertain. You will need help. You'll need help for your patients. At times, you'll need help for yourselves. It will take courage to admit that you made a mistake, that you're wrong, that you don't know enough, that you don't want to do this anymore today, that you're too tired, that you're frightened. There will be times in medicine when you will feel very alone, when the people that you work with and for are not on your team, when you feel let down and betrayed by people you should have been able to trust and rely on, times when you'll feel isolated and disrespected. There will be times when you have to stand up for what you believe in the face, of course, of people like insurance companies, in the face of hospitals and clinics, sometimes in the face of patients and families, occasionally in the face of colleagues and supervisors. I can remember times in my life when I have not done what was right. One in particular I want to share with you today, and this is from quite a long time ago. I was a medical student at a hospital in London more than 40 years ago. Yes, I went to medical school when I was a baby. And there we were on Friday afternoon at the end of a rotation, at the end of our third year, on the medicine ward, and we were not interested in going into internal medicine for the rest of our careers. It was Friday afternoon, it was 3 o'clock. We'd been up all night, we were tired, we were bored, and we were really hoping nothing else would happen so that we could go home early. And so around 3, 4 o'clock in the afternoon, this man got admitted to the unit. And he was young, he was probably around 35 or so, and he had had multiple sclerosis, and he lived on his own in London in an apartment, and he'd had an exacerbation of his illness. He'd lost a lot of function, and he'd been lying around at home alone for quite a while, probably several days. He was filthy. He was really dirty. And nobody had washed him on his way up to the ward, so he ended up in a bed on the ward, and we were the medical students, and so, of course, like all medical students, what are you supposed to do? Well, we didn't want to do it. None of us wanted to examine the patient. We just kept hanging around, and we were cowards. We didn't want to get our hands dirty doing something that was pretty unpleasant. We all pretended we were doing something else. And then the senior resident arrived, and he was really tired because in those days it was before duty hours, so he'd been up all the previous day, all night, and he was up all day, and he was about himself to go off for the weekend. And he looked around to see what we were doing and who had actually clerked the patient and taken the history and done the exam, and realized pretty quickly that we were all being cowards and wimps, and none of us wanted to do what we were supposed to do. And we weren't doing our jobs. And he didn't say anything to us. He went and washed his hands, and then he sat down beside the bed of this young man's patient, and he took the patient's history, and then he examined him carefully and thoroughly with his bare hands. And then he talked to the patient about what was going on, and the management plan, and the treatment, and the next steps, and of course that's 40 years ago, so there was care, but there really wasn't a lot of cure. And then he shook hands with the patient, and he looked him in the eyes, and then he left. I'll never forget the look on that patient's face as he shook hands with his physician. The patient felt respected. He'd been treated as an equal. His doctor had seen his humanity, and I felt really ashamed for being a coward and for not doing what was right and following the crowd and not standing up for what I should have been standing up for. I've really not tried hard not to be a coward again. Don't be a coward. Your patients don't deserve it. Your families don't deserve it. As Shakespeare said, cowards die many times before their deaths. Live a little. Stand up for what you believe to be right. Believe me, you'll have lots of opportunities. Medicine and the industry and profession of medicine is kind of technicolor. There's lots of drama every day. And so finally, there is much to be grateful for. I want to say thank you again for asking me to be here. Thank you to your families and friends for being there for you. Thank you for what you've done and for what you will do as physicians in your future careers. I'm going to finish this with Albert Einstein. Albert was not a doctor, but he was certainly a wise and clever man, and here's what he said. From the standpoint of daily life, there is one thing we do know, that we are here for the sake of each other. Above all, we are here for those on whose smile and well-being our own happiness depends, and also for the countless unknown souls with whose fate we are connected by a bond of sympathy. Many times a day, I realize how much my own outer and inner life is built upon the labors of my fellow men, both living and dead, and how earnestly I must exert myself in order to give in return as much as I have received. That's the end of Albert. Thank you to each of you for being willing to exert yourselves, to give as much as you have received and more in your past and in your future lives as physicians. Welcome to medicine. I don't know about other professions because I haven't done them, but medicine is an overwhelmingly demanding and truly most rewarding profession. For me, it has been really worth it. I am glad that I did it, and I would do it again. Thank you for taking on the burden. Each time I've seen a medical student walk across this stage over the last 11 years, I have been grateful because the world is a better and safer place because of what you are willing to do. It has been a pleasure to have been part of your journey and an honor over the last 4, for some of you, 5 years. Some of you even longer. Good luck. Be safe, be kind, and above all, be happy.
Thank you, Rachel. We're going to move on to our oath, and the general public undoubtedly thinks first of the Hippocratic Oath when thinking about graduating medical students, but there are several similar oaths that are also administered. Many feel that the wordings of these alternative oaths are preferable because they are more contemporary. For many, many years at the University of Missouri School of Medicine, we have selected the Oath of Geneva. This oath is printed on the back of the commencement program. Because of the solemnity of this moment, I ask the students, the platform party, and the audience to rise and follow along as I administer the Oath of Geneva to the class of 2017. So repeat after me. At the time of being admitted as a member of the medical profession, I solemnly pledge to consecrate my life to the service of humanity. I will give to my teachers the respect and gratitude that is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets that are confided in me, even after the patient has died. I will maintain by all the means in my power the honor and the noble traditions of the medical profession. My colleagues will be my sisters and brothers. I will not permit considerations of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will maintain the utmost respect for human life. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honor. Please be seated. I would now like to ask Dr. Michael Hosokawa, Interim Senior Associate Dean for Education, to come to the podium to lead the next part of the ceremony.
We are, we are nearing the time that each of our graduates will be recognized. One by one, we'll invite the class of 2017 to the stage to receive the doctoral hood. They will also receive the Doctor of Medicine diploma. Wearing a hood as part of the academic regalia signifies achievement of the doctoral degree. The color of the velvet outside the hood represents, represents the degree the wearer has earned, in this case, green for medicine. In addition, the silk inside lining shows the colors of the school from which the wearer has received the degree. Members of the class of 2017 will receive hoods with the black and gold lining, matching the ones worn by members of the faculty on stage with us today who are proud graduates of this medical school. Each year, the graduating class honors members of the faculty by electing them as investiture marshals. The investiture marshals assist in donning of the doctoral hoods. So before we proceed, it's my privilege to introduce the investiture marshals for the class of 2017. Dr. Nathan Buki, Associate Professor in the Department of Child Health. Dr. Buki is a 2004 graduate of the Missouri School of Medicine, and he also completed his child health residency here. He has been recognized for his outstanding teaching on numerous occasions and serves as the chapter counsel for our MU Honor Society chapter of Alpha Omega Alpha. The next investiture marshal is Raghav Govindajaran, the Assistant Professor in the Department of Neurology. Dr. Govindajaran received his MD degree from Bangalore Medical College in India, completed his neurology residency at the Cleveland Clinic in Florida, and completed his neuromuscular fellowship at Washington University in St. Louis. Dr. G has also received numerous teaching awards, and in 2016, he received the Association of American Medical Colleges Leonard Tao Humanism in Medicine Award. Our third investiture marshal is William Salzer, professor in the Department of Medicine. Dr. Salzer received his MD degree from the New Jersey Medical School and then went on to complete his internal medicine residency at North Carolina Baptist Hospital in Winston-Salem, North Carolina. He also completed a fellowship in infectious disease at the Bowman Gray School of Medicine. Dr. Salzer has been recognized many times for his teaching and contributions to the education program here at MU. He has been chosen multiple times as investiture marshal. And last year, for the graduating class of 2016, Dr. Salzer was chosen commencement speaker. This is an important occasion, a joyous one. So as we proceed, please feel free to applaud as members of the class of 2017 receive their doctoral hoods and diplomas. Family, friends and well-wishers are encouraged to help make this moment memorable. So, are you ready? Then let's proceed. Honored guests, ladies and gentlemen, on behalf of the faculty of the School of Medicine, it is my privilege to present to you the members of the class of 2017.
Samiat Angubiyade.
Luke John Andrea.
Thomas Wesley Andrews.
Nicholas Richard Arnold.
Ryan Earl Bailey.
Jeffrey Cal Berry.
Benjamin Dominique Brazil.
Brandon Paul Brewer.
Madeline Louise Brooke.
Meryl Bruni.
Gregory Sejas.
Frank Chan.
John Cloisi.
Kelsey Coe.
Robert Crystal.
Jesse Day.
Arshan Debikorgi.
Riley Sean Duckworth.
Shelby Terrell Emmett.
Whitney Diane Ficker.
Michael Ford.
David Ray Gilly.
Corey Ron Gooch.
Tyler James Gouge.
Emery Gray.
Jamie Beth Hadley.
Mamdou Hana.
Landon Robert Hendricks.
Cameron Hinkle.
Angela Marie Hulsey.
Gabriella Johnson Stamper.
Charles Phillips Jones. Hooded by his father, Dr. Gordon Jones.
Caitlin Kathleen July.
Stephen M. Kalkoff.
Paige Kylie Kuhlman.
Kathleen Sadie Quater.
Sing Ah Lee.
David William Lesko.
Calvin D. Lewis.
Hal Aaron Lewis.
Jung Lee.
Mohammed Shafi Ali Khan Lodi.
Teresa M. Long.
Simon Anthony Martin, hooded by his father, Dr. Peter Martin.
Shakshi Mathur.
Kayla Brooke Matzik.
Marlena Michelle McDowell.
Drennan Sticks Murching.
Matt Mooberry.
Ryan Morrow.
Brett Kobe Neal.
Jay Nelson.
Marina Atif Nematala.
Maxwell David Newby.
Alyssa Kurtz Oviet.
Jay Patel.
Pooja Patel.
Stephanie Margaret Peace.
Andreas Christopher Placus.
Ryan Kent Rader.
Mark Joseph Robertshaw.
David J. Rosenfeld.
Jacqueline Marie Ross.
Emily Putz Rodloff.
James Robert Rodloff.
Ashley Christine Ruff.
Benjamin Douglas Schmidt.
John E. Schneider.
Stacy Gwen Schneider.
Kelsey Marie Schreiber.
Aaron M. Shue.
Alexander W. Scott.
Emily Sellers.
Allison Elizabeth Sindel.
Whitney Ray Snydens.
Gary Lee Stover, Jr.
Jeff Schwartz.
Ashley Murray Sweeney.
Marlena Sefcik. Hooded by her mother, Dr. Susan Zarowski.
Mitchell C. Tarka.
Sarah Kimberly Teepee.
Misty Faye Todd.
Shizuka Tamatsu.
Stephanie Irene Benny Tosh, hooded by her spouse, Dr. Anish Tosh.
Alex Tung Suvik, hooded by his father, Dr. Mark Tunsevik.
John Scott Underwood.
Spencer Maxwell Vale, hooded by his mother, Dr. Janie Vale.
Sun Vo.
Molly Gabrielle Wasserman.
Kara Noel Watson.
Brian Weiss.
Ryan Dean White.
John Robert Worley.
Kristen Michelle Wymore.
Patricia Young.
Sydney Cartwright Young.
Jacob Andrew Zimbles.
Marcin Zubrick. Congratulations, class. Well done.
I would now like to ask Dr. Delafontaine to come forward and confer their degrees for the class of 2017.
All right. Another 2 minutes, gents and ladies, and you're going to be all physicians, right? All right. With authority vested by the Board of Curators, it is my privilege to now formally confer upon each graduating senior the degree of Doctor of Medicine with all of the rights and privileges pertaining thereto. Congratulations, class of 2017. I want to take a moment and recognize two students who are receiving the MD PhD degree today. Dr. Kelvin Lewis and Dr. Gabriella Stamper, and ask them to stand. They could please stand. This dual degree is one of the most prestigious offered by the university. Dr. Lewis and Dr. Stamper are now trained both in medicine and in research, giving them a unique opportunity to develop new treatment for diseases and to advance the boundaries of medicine. Please join me again in recognizing the class of 2017 and Dr. Stamper and Dr. Lewis. Before we proceed, I'm going to ask the students one question. Is there a doctor in the house? All right, that was better. Yesterday, the School of Medicine held its annual Honors and Awards convocation. Many of these graduates were honored at the convocation. I hope their families were present to enjoy the moment. Your program today includes a list of all of yesterday's award winners. However, it is our tradition to reserve for commencement some additional special awards that I will now announce. The first one is the Dean's Award for Outstanding Achievement in Academic and Clinical Proficiency. This award is given to the student, and actually now doctor, with the best academic and clinical record throughout medical school. This year, the award goes to Dr. Molly Wasserman. Please come forward. The next award is the Holt Leadership Award, provided by two alumni of the School of Medicine, Drs. Jean and Richard Holt. Dr. Jean Holt is a faculty member at the University of Texas in San Antonio. Dr. Richard Holt is Professor Emeritus in the Department of Otolaryngology at the University of Texas Health Science Center in San Antonio, and is also a scholar at the Center for Health Ethics at the University of Missouri, and is an adjunct professor in the Department of Otolaryngology. This award is presented to the graduating student who has best exemplified the highest moral, ethical, and leadership traits, and who has served as a peer role model, served in a leadership role in student organization, and provided service to the School of Medicine above and beyond the normal core. The award winner is chosen by Drs. Jean and Richard Holt from a list provided by the Faculty Awards and Scholarship Committee. This year, the award goes to Dr. John Cloisi. Please come forward. The Student Leadership Award is presented to a member of the graduating class who has been selected by a vote of his or her classmates on the following criteria: evidence of leadership qualities, peer acceptance as a potential leader in professional activities, a student who is a doer, one who characteristically assumes leadership in the day-to-day activities of the student community. This award goes to Dr. John Cloisi. As part of the commencement ceremony today, we will have the military promotion ceremony for two of our graduates, Dr. Ashley Ruff and Dr. Stephen Kolhoff. Dr. Emily Benzer will lead this ceremony. Dr. Benzer, please come forward.
Morning, everyone. Thank you for coming. We have been celebrating a huge milestone for this graduating class today. And Ashley and Steve have another milestone that they are also going to celebrate. Today they get promoted and they begin their careers as military physicians. And I have the honor of promoting both of them. Their promotion is a reflection of the hard work and dedication required to complete medical school. And I know that they will bring these qualities to their residency and their military career. And they will be a great asset to the military medicine community. I, for one, am excited for the day that we all complete our residencies and get to work together. So I'd like to invite them both to come up here with their family and receive their promotion. So if you will both raise your right hand and repeat after me. I state your name.
I, Ashley Ruff,
Do solemnly swear
do solemnly swear
that I will support and defend the Constitution of the United States of America
that I will support and defend the Constitution of the United States of America
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
and that I will bear true faith and allegiance to the same
and that I will bear true faith and allegiance to the same,
that I take this obligation freely
that I take this obligation freely
without any mental reservation or purpose of evasion,
without any mental reservation or purpose of evasion,
and that I will well and faithfully
and that I will well and faithfully
discharge the duties of the office on which I am about to enter.
discharge the duties of the office on which I am about to enter.
So help me God.
So help me God.
Congratulations, guys.
To close the graduation ceremony, the class of 2017 have chosen Dr. Greg Sayas. Dr. Sayas, please come to the podium.
I'll try. Hello, my name is Dr. Gregory Sayas. But please call me Greg. How'd that sound? I'm going to try and use it for patience, Ben. Is that good? Yeah, all right, cool. So I'd like to thank my classmates and our friends and family. This is going to be a problem. And staff for joining us this morning. It's an honor and a privilege to be able to speak to you all. As my classmates know, I've never turned down the opportunity to speak to anyone, really no matter the topic. And though I'd love to do a whole spiel about my love for the burgers of Booch's, for 10 minutes I suppose I should focus on the task at hand, which is to send you all out into the world with a newfound purpose and zeal for medicine that was previously untapped. So with that, Merriam-Webster's defines doctor as a person skilled or... All right, I can see by the faces that was the wrong approach. So instead we're going to start with a memory. Nearly 4 years ago in this very building, we received our short white coats in a ceremony that can best be described as mildly calamitous. The white coat part went fine. It turns out that all of us were more than capable of putting our arms into sleeves with the help of an adult. After years of practice with various articles of clothing. No, the big hiccup happened afterwards when our class was asked to repeat the same oath that we did today. That was being spoken to us by Dr. Hall at the time. This was not a surprise to us. We were told that this would happen. What was unknown to us and to Dr. Hall alike was that the paper copy of the oath that was given was outdated. For those of you who weren't there, you're probably thinking that we could have just listened to what was being said rather than relying on the written form, but you're giving us far too much credit. The result of this accidental experiment was a confusing mishmash of non-matching words, mutterings, and really nervous laughter that left the audience confused and the participants slightly embarrassed. As I was thinking of what to talk about for this, my mind kept coming back to that day and that mix-up in particular. More specifically, I kept thinking about that moment just before Dr. Hall started speaking, the calm before the awkward storm. In that moment, I can safely assume that none of us were thinking, oh, well, we're about to look like kindergartners performing at a Christmas recital. And yet there we were mere seconds later with that familiar feeling of blood rushing to our cheeks as we realized this was about to be bumpier than we expected. And I've been trying to figure out why this resonated with me so much, and I think it comes down to two reasons. First, it was very funny in hindsight, and more importantly, was remarkably fitting for our class. A running theme of our 4 years in medical school was unexpected changes happening to curriculum or the school itself on the fly, which was typically immediately followed by under-the-breath cursing and complaining amongst ourselves. But just as common as these events occurring was that they all turned out mostly okay, aside from a few extra tension headaches. In the same way that we rolled our eyes and laughed off the oath once the ceremony was over, we would go to Quinton's or Shiloh's or really wherever there was a pint that day, commiserate about the test or that block and complain a little more, and then we'd move on to the next area of conversation. It may not have been how we expected things would go, but we got through it every time. And now we're here, dressed like Harry Potter extras. But I think what most interested me in talking about that moment is the concept of the unknown, the unseen but present variable that gets thrown into the equation at the last minute. And I know that's not how math equations work, but stay with the flawed metaphor. In the case of the oath, no one besides the person who printed the sheets knew that we had an outdated script. So by the time anyone knew something was off, it was too late. This kind of thing happens all the time in life, certainly. When a figurative strip of black ice comes out of nowhere to throw you into a swerve. But nowhere in life are the stakes higher for getting the car back on a straight path than in medicine. Except for with real black ice. That's probably a more pressing matter. I joke, but this is probably the heaviest and frankly most challenging part of our careers, regardless of specialty. How do you react? How do you approach the situation when the unforeseen and unplanned happens? How do you keep going when that approach fails? You can read all the textbooks, peer-reviewed journals, and WebMD articles that you want, but rarely do these consider the moral, social, or ethical hiccups that we'll be encountering with real patients in real-life situations. Preparation and education are obviously crucial, but when push comes to shove, our decisions and surprise circumstances are often the difference between good and poor outcomes. I know that sounds scary, but it doesn't have to be. You've likely already been dealing with the unknown on your way to getting this degree. At the very least, I can guarantee that the path you took to get your MD was different than the one you envisioned taking when you got your acceptance letter to Mizzou. Maybe you decided to start a family a little sooner than you thought, and suddenly studying became a bit more challenging. Maybe you or your family were dealt an illness or a loss that didn't seem, frankly, possible before. Maybe you decided to get married and you had to figure out how to be a good student while also being a good spouse. Hell, a couple of you married each other, so. But despite these twists and turns, you still made it here. You likely made some mistakes along the way, but you were here, and you were a doctor. I'm a relatively young man, but if there's one thing I've realized in this life, it's that the best opportunities for learning are the ones where you start out with no idea what to do. Yes, the careers that we are about to embark on will be scary. They will be full of surprises, and they will demand more of us than we think we have at times. But these unforeseen obstacles also contain opportunities for self-discovery in the practice of the art of medicine. So embrace the unknown. Lean into the adversity. You may not succeed in every circumstance, but you'll be a better physician for it. It's been an honor to be your classmate. It'll be a privilege to be your colleague. And I cannot wait to see how you all grow and thrive as doctors. I will miss you all dearly. I love you all. God bless. Thank you.
Before we finish today, I want to particularly thank all of the School of Medicine staff for their assistance with today's event and for all the support they provide for our educational programs. I'm happy that you could be here with us today. Class of 2017, best wishes.